Let's see. Let's see what we have to do. That's good. That's so crazy that I'm doing. Oh, I see somebody coming out. Trying to get this thing together. Who does this? They're live. There you go. I know. I always hate when I hear people say that. Oh, I'm just waiting for a few more people to come on. And here I am doing the same thing. So let's see. Oh yeah, I think this is better. This is better. Ooh. We have a nice dinner company of 2 people. How cool. Trying to prop this sucker. Oh, hey, Sharita. I think you're my #1 fan, girl. I'm gonna try to work out some type of schedule to maybe do some live tutoring, which is really what want this to be. But I didn't set a schedule yet. You're asking when exactly do I do live, so I hadn't set up a schedule yet. So hopefully soon I'll get some sort of schedule. But nice to see you, Anna. We just wait for a few more people. You know how that usually works. Um, what did you leave already? Oh, I like this red. This red looks cute. I think this might work. Good. Oh, I have this pressed on. I was just going to M. Let's clear that out. I am, you interviewed me during, oh wow, congratulations. That's awesome. That means you said the right things at a professional level. That's really cool. That's awesome. Congratulations. You are in the program. It's tough, as I'm sure you're discovering, but I think that's really good. I think that's good. That's really all you can do. That's really all you can do. Put myself. I'm gonna turn the volume down over here. Um, you could inbox me how. Oh, my red looks good. Look, I'm showing a little QCC. At some point, I'll be kind and show some other school shirt, but for now, you have to take care of home. So I have so many QCC shirts. So I also have a shirt with my channel name. But so put something in the box and let me know who's here. And that's good. I know. Well, there's a 101 student here. Great. 102, which is your goal. Those students are coming on. Hopefully, they had their exam yesterday, and so today I was like, let me just come on and just see how they are, if they're breathing, after an exam. So, any fundamental students listening, you can get some tips from the other upper semesters as to what to do. And wherever you are, I make no assumption that all the students that come on here are from our school. Again, as this channel gets a little bit bigger, which goals, I'm hoping that other students will come on. You learn, with nursing or standardized tests. Oh, this red is popping. Um, Standardized tests, they're designed that any fundamental of nursing student, I'm going to say the U.S. What time? Well, oh, Sharita, I haven't set that yet. I'm gonna try to do some sort of scheduling. So right now I've been doing a live. I mean, I do upload some videos, but right now I've been doing a live on Tuesday nights at 8, 7 or 8, because there's usually some exam going on. So if you want, give me an idea, of what's a good time for you. Sometimes I have to adjust the schedule. I do travel a lot. I don't want to schedule something if I'm on a plane. But ideally, evenings are a bit better for live tutoring. And, for the people who are working evenings, no. But for other people, it might be for those who are working live. So, who are working in the daytime. So, maybe do something like that. Um, most of you're in school during the daytime. Hi, Kevin. You're in school during the daytime, whether you're in Zoom or not. So I wouldn't schedule a live there unless something ridiculously popping happens in the news. And again, I want you to be current. I want you to be current in that. So I would do that. I haven't seen any 102 students on yet. So who else is on with Sharita? We're having a nice, quiet evening. Do you teach 101 this semester? Just clinical. I don't lecture. So are you Monday, Tuesday, or Thursday, Friday? I'm gonna have to get me some more red shirts, man. This red and white is, yeah. Monday to Thursday. So your lecture, Professor Reichard is your lecturer? Professor Reichard is your lecturer. You're in good hands. Yeah, so Monday through. Okay, good. So Professor, she's good. She's a really good human being. She wants you to do well. But all lecturers do different things. So I'm not lecturing this semester, but I do. We all play a role in how you're Mobian for lab. Okay, good. So see you Monday, Tuesday, and that's clinical. So yeah, Nancy Mobian. Yeah, we're all adjusting to this different. I'm so tired of wearing this mask. I truly do not like it. But it's necessary between the mask around my ears and the glasses on my nose. It's fogging. It's just insane. But we'll get through it. So, Sharita, so you can tell your classmates. Tell them to come on. I mean, listen, this is no competition. It's to help you. So once I get a schedule, I'll probably send it through the. Again, this is not a school channel. It's my private channel. So it's not just Queensborough students. Ideally, any student and not even non-students can come on. Once I decide in a time, so I would have to do. So right now, I've committed to doing a what's on the test live video on a Tuesday night, 7 to 8 p.m. So that's like one thing I've committed. So perhaps trying to figure if you're going to have a lecture on Wednesdays are just such a busy, crazy day. And, I thought maybe Fridays, I thought maybe a Friday evening might be a good time to do a live tutoring. It's kind of a wrap up for the week, so where students can, I'm not coming here to lecture. I mean, I could do mini lectures, but where students, can ask the questions on the content that they've had for the week. So I think a Friday evening, late Friday evening could be can you do videos on different labs or lectures? I need more help. On different labs or lectures. Well, don't put your grade out, but that's, it's hard to do the labs. So, maybe what I'll do, Sharita, I'll probably try to, but again, I have to be consistent. That's really the thing with YouTube. It just can't be random. So perhaps if I could do it, I know Professor Reichard, she would have no issues. She won't think, she wouldn't think that me doing a video on the content for the week, was like, because she didn't do it. No, she's excellent. So, perhaps just a different perspective, a different, give you some tips on what to focus on. That's really how I would do it. I mean, listening to another lecture is just really another lecture. You just say the same thing in a different way. So, Send me a private inbox. Okay, right. Okay, good. So maybe, so I think so. So from your suggestion, maybe I'll do like a Friday. So maybe tomorrow's what? Again, if I have to change the time, it's probably because I'm either traveling or something. But maybe like a Friday, and because then you can ask questions related to the content for the week. So I'll know your content for the week. You have either had some success or issues. So maybe we could do like a weekly, for now, maybe Friday, 7 o'clock. How's that? Friday I'm out. Oh, I'm sorry. Well, what do you mean Friday you're out? Friday's not good for you? I mean, I got to, Friday, so to me, it makes sense to do it as a wrap up, because it's kind of a review, to do something on a Monday on stuff you haven't covered yet. So, you got to go through that first. And then, but we'll work something out. Maybe I'll put your guidance. I'm working a double on Friday. Oh yeah, that whole thing. I didn't hear that. I know. I always tell students, I'm telling you, and y'all say whatever y'all need to say, and we know the real. Listen, I'm being honest. We know the reality that students have to work, but it's tough work. Work in this is tough, and as I'm sure that you are now experiencing, you're probably doing a double, so you have other days off during the week. But it's draining. But here's the only consolation: there are people who don't work who still do poorly. I'm not sure if that's a consolation for you, but oh, I'm loving. I wear this red shirt all the time, but I seldom film in it. I usually have a white shirt. I'm gonna wear a red shirt more often. You betcha. I put some. Who is this? You can do old lectures. It doesn't have to be the current lecture. I know, but yeah, I'm not doing a whole lecture here. But I do have class. um, yeah. So look through. I'm trying to figure what's on. Last semester I was doing. I mean, last week. Okay, I know. Got you. Last semester I was doing some videos, just some specific things to give you some ideas. Perhaps I'll do a few more of those. I know there's a video all about LASIX, which coming up, maybe for exam number 3, all about LASIX. I think there's Zithromax. Those are 2 medications that's on your list. I didn't do it on vancomycin, so perhaps I should do that. Yeah, maybe I'll probably go through your list of medications. Those list of medications that your teacher probably have been referencing. Maybe do 1 or 2 videos. I probably could do it here. It's nighttime, so the window's closed. But yeah, meds are great. Okay, good. So I'll tell you what videos. Go search through the channel. I'll tell you what's there. There's a video on LASIX. There's a video on Zithromax. I did that Zithromax video because a friend of mine inboxed me in Messenger that he was prescribed this medication. So I gave him. I'm like, listen, if he needs to know, maybe somebody else. So okay, so maybe I'll do some more on meds. I'll just call them the basics. Furosemide, LASIX, the basics. That's really all it is. It's really the basics. I'm not teaching you to be a pharmacist, or you're not a prescriber, but there are some components that you must understand in order to know if the dose is appropriate for the right patient, the right dose, and all the dynamics that go around it. Need to know some of how it works in the body, how it gets out. For instance, like vancomycin, you'll memorize. It affects your kidneys, so you need to then expand and think. I'm not going to ask you which of the following organs does vancomycin affect. That's like a straight Jeopardy memory conversation. Patients being prescribed and treated for some septicemia with vancomycin, which of the following are priority assessments, and you need to understand that. Patients being managed on furosemide LASIX, whether we tell you what it's for or not. Again, it's a medication that you're responsible for, so you should have some understanding what diuretics do, how diuretics work, what's your assessment before, like what labs needed when a patient. Well, yeah, so for instance, when a patient is on a certain med. So again, back to there are tons of medications, and you're expected to know the medications that are currently in your lab manual. And those go according to some of your your topic. So for instance, when you did vital signs and then you transition to a little bit of hypertension, I believe you have metoprolol as one of your medications. For sure, for sure. I believe enalapril is also there, and digoxin. Exactly. So those medications, don't go. There are tons of blood pressure medications. You can't be responsible for all. So we give you a couple of those. So, by the time you get through fundamentals, you will know how metoprolol works. You will know how Lasix, you'll be tired of Lasix, but it doesn't go away. You will know digoxin till the cows come home. Digoxin, digoxin, digoxin. Apical heart rate full 60 seconds. Check the dig level because it can be toxic. It can affect the kidneys. Check the lights. You know digoxin. You will know. Oh, somebody else came on. Introduce yourself, who you are. Let's say. Got it. You cannot pin him. Let's say Cherie. Let's see who. Say something. Say something so Sharita don't feel alone. I'm so happy you interviewed you this summer. That's funny. I probably was sitting here doing this because I move around the house. I always find like a nice wall because I'm not trying to invite you into my house. People like to show their house. You only get to see that when you're invited over for tea, Just saying. Meds, yeah. And I mean, even on a fundamental level, I would expect a student to understand. Let's take an antibiotic. I don't expect you to know everything about every antibiotic. You should understand broadly what are antibiotics? What do they do? I tell students, try to memorize, understand, process, store information, especially about medications. Try to say to yourself in a way that you would say to a patient. A patient is being prescribed heparin. A patient comes in, patient's dizzy, patient fell, and just for safety, temporarily, they want to put this patient on bed rest for safety. In most progressive medical centers, they have some type of protocol when someone's put on bed rest. And many times that protocol involves giving them some type of a low dose heparin. Now the number seems big, but it's really a small dose. So heparin, 5,000 units, subcutaneous in fatty tissue, every 12 hours for an average size adult. Sometimes it's 3 times a day for somebody obese and a higher risk factor of other type of clot. Now, how I would explain this to a patient, again, remember, unless it's the emergency room where you haven't gotten much information on them, as part of your nursing, your first health assessment, you're asking that patient certain things about how you assess their mental status, you assess their cognitive ability. You're not doing a big, long test, but you want to know, can they read? What language do they read? Do they prefer to information given verbally or in a written form? So I would explain to somebody, based on what I know that patient, I would say to that patient, Miss, Sir, whoever, however you are, I'm giving you this medication according to your records. You've never had it before. You're getting this medication called heparin. It's an injection that goes in fatty tissue, and that's one of the easiest places to find some fatty tissues in the abdomen, in the abdominal area. This medication is being given to you because you're being put on bed rest now for your safety, and being in bed, not doing the movement that you normally do, can put you at risk for developing a clot in your leg that could travel through your heart, lungs, and your brain, and this medication can minimize that. That's how I explain it to that individual. And then I talk to them about, it works this way. And some of the things that we have to watch out for is bleeding. So if you see some parts of your abdomen have like a little black and blue mark, it's from where the needle goes in, and I'll teach them some more bruising. That's it. That's how you should be able to. Now, I'm sure some lecturers talk about, well, heparin is an anticoagulant, has a half-life of 6 hours, and the patient got time for that? I mean, you don't have time for that. Yes, you need to understand that, do the reading on that, and half-life, and PTT. As a matter of fact, patients getting subcutaneous heparin don't do the PTT. It's when they're getting the intravenous heparin for treatment, a known DVT, MI, emboli, embolic stroke, or whatever. But a patient who's getting subcutaneous heparin, prophylaxis to prevent, explain that. Patient may say, oh, is that what they call a blood thinner? Yeah, that's what they call a blood thinner. That's good. We're done. We're done. Don't use big words on your patient. You ain't impressing nobody. The patient could care less. You want the patient to be able to understand. Now, if you happen to have a patient who's a nursing student in some of the school, of course, you can have you want to give information on the patient's level of understanding, level of learning. And listen, patients like, oh, just give me this needle and get it over with. in those means rather. So I encourage you to take the complex, even in words, try to put it into simpler terms, how you'd explain to a patient. Not that the patient doesn't understand complexity. It's just, I'm in there in chest pain. I ain't got time for you going to nursing school. You want to come in and tell me 20 things? Girl, just give me my pain medicine. You know what I mean? So you have to understand the situation, understand your patients, and no two patients are alike. And just be mindful. But a good tip is, after you've learned all, for instance, hyperlipidemia. Such a big word. It's like supercalifragilisticexpialidocious. Yeah, high cholesterol. Same thing. Why am I here? Your cholesterol level is high. Do you know what? Oh, that's about the fat. That's enough. That's enough for now. And then you may talk about good fats, or even talk about what can help the cholesterol go. The patient ain't got time to spell hyperlipidemia. It sounds like, I'm just saying. So sometimes students, based on some lecturers lecturing those big words, and you got to take it and make it simple. So a good tip is to try to figure, how am I going to explain it to this patient? Patient says, oh, they tell me that I have an embolic stroke. That patient here is stroke. It's stroke, so you can talk to the patient. I would ask that patient, can you tell me what you know about strokes? Oh, stroke is when your brain gets messed up, or however they put it. That's a start. Has to do with the brain. I would say, well, you can have strokes for different reasons. You could have high blood pressure, a small vessel could rupture, that's what they call a hemorrhagic stroke. What you're explaining is you have an embolic stroke. It's an emboli, and it could be an emboli from a small blood clot, and that prevents blood from going to the rest of your brain, and that's why you had a stroke. Explain it that way. Don't do all this big fancy word. Well, Miss Sharita, I think all my 102 students, not mine, they're probably I don't know, at the bar, drowning their sorrows from yesterday's exam. But I wish them well. Let's just see. I really wish them well, and I hope it's okay. And to you and whoever the other person is on, I wish you well, and just try something. So I'm gonna check out of here for now, and y'all have a wonderful night. Let me just end this the right way. Last time I didn't end it right. So y'all have a wonderful evening, and all the best. Okay, awesome, Sharita. So there we go. Perfecto. So funny. I have this going. I have my computer going because gadgets. I mean, who doesn't? Tons of gadgets. Tons and tons of gadgets, which I love. And we're definitely going to do those. All right. So have a good night. Sometimes when I leave it like this, then